are also a world leader in health policy and public health policy in particular. And that's why I want to welcome the World Health Assembly motion, which passed overnight, a consensus motion passed unanimously with 137 co-sponsors. And Australia has helped provide the impetus and the resolve to ensure that we have an impartial, independent and comprehensive evaluation of the origins, the source, the passage, the response to COVID-19. Those things together are about saving lives and protecting lives, medical research and public health policy. So today I am delighted to be able to announce almost $400 million for 267 projects under the National Health and Medical Research Council and the Medical Research Future Fund. These projects are immensely valuable. $87 million for cancer research, $54 million for mental health research, something which is so much in focus at any time, but particularly during the course of the isolation and the pandemic. $46 million for cardiac funding, and in particular, $84 million for infectious disease control and research. One of those projects is Professor Alan Cheng's $1.7 million, which is looking at vaccine preparedness, in particular with an influenza and pneumonia focus, but with the capacity to apply the learning and the research and the knowledge to coronavirus or to future pandemics or epidemics that break out either in Australia or across the world. So that research is fundamentally important to this crisis, but to future crises. More broadly, as Margaret said, Monash University, $47 million received for 30 projects, a national leader, a world leader, but part of our Australian response to any international crisis and part of our capacity to help provide the world with support and help protect Australians as we go forward. But there are universities right across Australia that are participating in this. 267 projects, $399 million. Examples such as the University of New South Wales, $620,000 for research into youth mental health, such an immensely important, potentially life-saving program with a focus on depression and anxiety amongst young people. The $2.7 million for the Queensland Institute for Medical Research, which is focusing on genomics and decoding the genetics of breast cancer. These are real projects of immense importance to the lives of Australians. So whilst we are dealing with COVID-19, we are also dealing with all of the challenges that Australians face in their ordinary health challenges. As part of that, I'm also pleased to be able to give the update in relation to COVID-19 for Australia. We are now at 7,071 cases, and sadly, as was noted yesterday, the 100th life was lost to coronavirus. In particular, there have been 11 cases in the 24 hours to 7 a.m. across the country. 6 states with no cases. One state, New South Wales, where all 4 of their cases were in hotel quarantine. And in Victoria, one of the cases was a hotel quarantine. So 5 out of the 11 cases have come from hotel quarantine, and that emphasises the first of our containment measures, border control, as being absolutely essential. In addition to that, our testing remains world-leading, both in terms of numbers and in terms of accuracy. And we've now had approximately 1.1 million tests conducted across Australia, which is a tribute to the work of all of our public health and private pathology providers. Third, within our containment strategy is our contact tracing. And our contact tracing continues to follow every case. We also have now 5.9 million downloads of the app, which I think is an extremely important development. We continue to have Australians downloading, and we will continue to urge Australians to download the app for the very simple reason it helps keep you safe. And then finally, we have our social distancing measures. And as we begin to emerge from some of the isolation, it's absolutely critical that we maintain our physical distancing. Physical distancing, the 1.5 metre rule, is about saving lives and protecting lives. And so it's fundamental that even as we re-emerge from our isolation, we maintain that physical distancing. And that will help protect Australians going forward. Finally, that brings me to the capacity in our system. We have helped build that capacity enormously. Over 7,500 ventilation units available around the country. We are now down, though, to 7 Australians on ventilation. And each one that is reduced is a cause for celebration. It's a cause to recognise that fewer and fewer Australians are at risk. We know, though, the challenge is not over, and so we have to continue to fight, which is why we have been so supportive, why we have helped provide the impetus, why the Prime Minister and the Foreign Minister have worked across multiple nations to see that an independent inquiry is supported and now has been supported through the World Health Assembly. And that is about taking the lessons, no matter where they come from, and applying them to protecting people from around the world so as we can move quickly, as Australia has done, but to make sure that every nation is equipped to move quickly, to save lives and protect lives. Australia's role has, I think, been a very important role in helping to see this resolution come to pass and this resolution now be enacted in a way that will give the world greater protection going forward.